The lecture is entitled An Introduction to the Medical Ethics Considerations and Value Approaches in Responsible Conduct of Research. Here we have the content. It is including principles and Roma Declaration of Helsinki. We have to know the ethical principle, which is somewhat different from what you have in the master degree, and we are trying to understand some codes of ethics like Roma Declaration of Helsinki. Let's start why we have medical ethics. It is to protect the participant of human research, which is one of the great aims in medicine. We know that all researchers should seek this ethical conduct of human research to optimize the benefit of the research and practice. And we'll know slightly about ethics committee and its role in ensuring the participant protection and monitor of the commitment of researchers to ethical code. With regard codes and policies for research ethics, as we told you, it is very important to conduct the research ethically. Each each government, agencies, universities, and countries are adopting specific codes and rules which we all should follow whenever we are doing this research. Some of the ethical principles of medical research, beside the beneficence, non-maleficence, honesty, and autonomy, which has been repeated in several uh, lectures, we have uh, objectivity, which we should avoid bias in the experimental design and data analysis and data interpretation. We should uh, avoid peer review bias, okay, personal decisions. Whenever we are doing research, it is for the research and for human being, and not to approve something due to personal communication or disapprove it due to bad communication. Of course, honesty is needed all over the steps as regard data, results, methods, procedures, no fabrication, no falsification. Don't take few cases and say I take 50 instead. Okay, we don't deceive colleagues or granting agencies. Integrity, of course, is one of the ethical principles. We keep our promises, acting with sincerity, strive for consistency of thought and action. Carefulness, we avoid careless errors, negligence to the patient, negligence to the safety of the patient, negligence to the dignity of the patients, of course, and to the work. Okay, we are keeping good records and good data collection for obtaining a proper outcome. Openness is sharing data and results with others. All of us, whenever we are finishing our research work, we are publishing this and making this is defended if it is a thesis. Okay? At the same time, we should be open to criticisms and new ideas. We are respecting the intellectual property. Don't copy and paste. Don't take any data from any other author and use it without his permission. Respect his patency, his copyrights. Don't plagiarize. Okay? Acknowledge any person who are contributing to that research. Confidentiality should be considered for the patient data, for the papers, for the grant submitted for publication. Whenever you are a mentor, you are a supervisor, you are the one who are giving the advice, be responsible for your action. Help the student to uh, be better, advise them, mentor them, educate them. We are respecting our colleagues. We are being responsible for our publication to advance the research, and we are avoiding duplicate publication. We should be competent. This means we are maintaining and improving our own professional competence and experience through lifelong education and learning. It is an obligation to educate yourself and continue to read and see what is new in your specialty all over your life. It is part of the medical ethics, and this is done for the beneficence of the patients. We have also social responsibility. We are promoting the social improvement and prevent social harm through research and education. And part of our work is improve the awareness of the society as regard the diseases or how to prevent such a disease. We should be fair. We are not discriminating against colleagues, students, or patients. And we should obey the relevant laws and regulation in institution and government. If we are working on animals, we should respect and care for animals using the ethical codes on such animals. Don't conduct unnecessary or poorly designed animal experimentation because they are animals. It wouldn't hurt them. As regards the human subject protection, we are minimizing the harm, the risk, and maximizing the benefits. We are respecting the privacy, confidentiality, and dignity of human beings involved in our research. We are respecting the autonomy, which is the choice or the choice of the patient for his kind of treatment. We are taking special precaution with vulnerable population and distribute benefits and burden of research fairly. The World Medical Association has been involving what we call ethical principles in Declaration of Helsinki. They explain to us what we should follow whenever we are using human being in research. For your participant, you should protect his life, health, dignity, integrity, right to self-determination, which is the autonomy, privacy, and confidentiality. Whenever you are involving human subject, this must be depends upon accepted scientific principles. Whenever you are doing a medical research, you should be cautious. Don't harm the environment. Whenever you are designing and perform that research, which will involve human being, these designs should be written in a protocol which should contain a statement that ethical consideration will be considered and declare if you are following certain ethical codes. Whenever you are finishing your research protocol, you should submit it to ethics committee before the starting of the study. And whenever there is a medical research, you should be qualified. Not anyone should be involved in a research on human being. They should be a qualified personnel, have appropriate scientific training. Each research will have advantage and disadvantage, and they can involve some of vulnerable population. This should be justified. The benefit should be outweighed risk. And if you are involving vulnerable population, you should justify why you should use this population. For example, if you use children, because this disease occurs only in children. Uh, Before starting your medical research, you should be carefully assessing the risk and the burden and the discomfort of the individuals involved in your research and be sure that the benefit is outweighed. Whenever you are making a clinical trial, which you are doing something very new, it must be registered registered in a publicly accessible database before recruitment of the first subject. And nowadays we have signing for clinicaltrial.gov, which is one of these registries. And we have another registry in the Ministry of Health. Medical research involving human subjects must only be conducted if the importance of the objective outweighed the risk. Physicians may not participate in the research study involving human subjects unless they are confident that the risk involved has been adequately assessed. You can see that there is multiple articles about the risk. Be careful of the risk. Don't do that research if this high risk outweigh the benefit and risk. You should assess both, and you should be sure that the benefit is better than the risk. All the participants should be competent, and their involvement in the research should be voluntary. We should protect the privacy and the confidentiality of the personal information of the participant. Whenever you are involving a competent subject, they have to know the aim of your research, the method, the source of funding, any possible conflict of interest, if there is institution affiliation of the researcher should be mentioned, the benefit, the risk, the discomfort, the different relevant aspects of the study. This is what we call an informed consent, and the potential of to be informed to refuse to participate in the study or withdraw their consent at any time. Whenever you are seeking informed consent from participants in a research, you should be cautious about the potential subject is in a dependent relationship with a physician or may consent under duress. He may be embarrassed. He may be signed without comfort. Okay, take care of this. For a potential research subject who is incompetent, you must seek the signature for informed consent from a legally authorized representative. When a potential research subject is deemed incompetent to give assent to decision about the participation in research, the physician must seek that their assent, and you have the word assent, not the consent. Okay, the consent, it is a legal form. You must be over 18, saying conscious, or otherwise your parents or your legal representative will sign for you. But assent means you have been told as a child, which means you are below the age of 18, what is the research and what is going on. In many research sites, they considered assent is one of the requirements, especially if the age of the child is 7 or more. The authors, editors, and publishers all have ethical obligations. Whenever you are finishing your research work and you write it and you submit it for reviewing and publication, all of you being an author, the reviewer, the editor, the publisher, all of you have ethical obligation about this accuracy, completeness, and unbiased of this report. Thank you.